Who declared diabetes as an epidemic? What would you say about?
If we see in the modern era, the diabetes is emerging as an epidemic proportion, especially in our Southeast Asia, part of the world. Uh, this is a chronic progressive disorder and comes with many complications. So we need to have strategies to address uh, the disease in its initial stages so as to prevent the complications.
Thank you, Rufso. Another big thing which comes up to our mind is what is the difference between type 1 and type 2 diabetes?
If we say diabetes is a disease which is uh, when the body has insulin deficiency, or the insulin which is produced by the body or by the pancreas is defective. So broadly speaking, we got two major types: type 1 and type 2. Type 1 is characterized by deficiency of insulin by the pancreas, especially found in early stages of life or teenagers. And type 2 is commonly due to defective insulin production from the pancreas, or a state what's called insulin resistance.
Okay. Okay. Are there any latest advancements in type 1?
Yes, there are many advances in type 1 diabetes management. Uh, Insulin is the mainstay treatment of type 1 diabetes. Uh, and what we have over the years been offered to the patient is what's called insulin pump therapy. So it acts as a artificial pancreas which delivers the insulin automatically as per the glycemic profile of the patient to the patient, and with very less chances of both hypo and hyper glycemic excursions.
Okay. So you mean to say hypo is something when the sugar levels are below the normal level?
That's
That is hypo.
that's right. When the sugar levels are below the normal or expected levels, that's the hypoglycemia.
That's a great information, doctor. And what are the latest advancement in type 2 diabetes? Because there are two types of diabetes, as you said.
Right. So type 2, our focus is, as I said initially, that in type 2, there's a defective insulin production, and it is most commonly associated with insulin resistant state. That means most of these patients are metabolically active. That means they are obese, and they got a dysfunctional fat in the body, which leads to this development of type 2 diabetes. So now we got very novel molecules available, like SGLT2 inhibitors and GLP receptor agonists. These are basically the two different classes of drug that helps us to address the various pathophysiological uh, defects of type 2 diabetes. And they're very effective, we have seen over the years, and very robust data is available for these kind of molecules.
I got it. I got it, doctor. And there's another thing which comes up to our mind is how to save these childrens, these neonates, getting diabetes. Nowadays, we see that normally many children they're found diabetic. So how can we save?
I think we have not reached a stage yet where we can prevent diabetes, which is present in neonates or young children, and most commonly these kids are having type 1 diabetes. Once diabetes sets in, it's not curable. We got a treatment for it. However, a certain subclass of patients, or neonates, as you say, or very early young stage kids who are at high risk of developing diabetes. For example, twins. One of them has got diabetes type 1, and the second one is also at high risk of developing diabetes. We got some kind of a drug which can delay the progression of diabetes, but as of now, we don't have any cure available.
Or that's it, the information, doctor. And is it true that we can't cure diabetes? We can only manage?
So, cure is a word which is dubious in the sense that it gives a false impression to the patient that, look, your diabetes is cured and now you're free of the disease. That's what the cure means. What we can do with life strict lifestyle modification, and this is applicable for type 2 diabetes. I'm talking about. Uh, with lifestyle modification and certain strategies and drugs, we can keep the diabetes in remission. Remission means we can keep it suppressed for a longer period of time without the need of any further medication. Uh, so that is possible. Even some people use the term reversal, uh, which is again not the preferable word to be used. But yes, that is possible in certain people with type 2 diabetes only.
Okay. So, what do you think is the future of the disease, the treatment, and how do you look at it?
See, we are now, this is we are entering into an era where the we understand the disease much more. Understanding is there. The defects of what leads to the diabetes. So much progress has been made. I think the future is bright. We got many good drugs available, and many more drugs are coming up, which can again have a good impact on the disease progression. So future is bright in terms of treatment of diabetes, but we need to. We are still far away from the cure.
Got it. And so, another thing which we see, we read is that vitamin D plays an important role in treating diabetes. So, how would you respond to that?
So vitamin D is, if we see, it's not a vitamin; it's actually a hormone. And there are multiple studies which have found that vitamin D deficiency or insufficiency leads to many other problems like blood pressure, insulin resistant state, decreased immunity, and other health problems. So studies have linked the vitamin D deficiency to diabetes, and yes, it's a common practice that every diabetic patient in particular should be assessed for vitamin D levels and treated accordingly.
Got it. And is it true in terms of if we talk about the females, the women, uh, they need to be more careful as the disease can cause menstrual problems also. And when to see their doctor?
Yes, I mean, diabetes can present with a varied symptoms and presentations, and in females, many females, especially young females who got menstrual irregularity or problems, can have a metabolic syndrome or what's called a PCOD. Okay. And insulin resistance is a part of that PCOD syndrome. And once if the females are insulin resistant, they are at higher risk of developing diabetes. So yes, any female with menstrual irregularity should be investigated for diabetes point of view too.
Got it. Got it. And how does it impact overall health of a diabetic? Somebody's diabetic, then what he can expect being a diabetic?
So see, diabetes is a lifestyle disease. What we have to understand is that it's actually a little bit of you need to have a discipline in life. So what we mean to say is that once a patient is diagnosed diabetic or a diagnosis is made, he need to have a good lifestyle in terms of regular exercises, dietary selection should be very sensible, and these are the two main pillars, and then comes the role of the drugs. So it's not like that a patient is diabetic, we prescribe drugs, and then everything is all good. No, so the lifestyle is the primary pillar for diabetes treatment.
Got so we have seen that when you recommend the insulin, um, uh, the general perception is that it actually hurts. Is there any oral option also?
When there is a need to prescribe insulin, it's now again the studies in India has been done, which shows that there's a delay of at least 8 years of insulin initiation. So when generally we prescribe insulin or we advise for insulin to a patient, he's already having the complications of poor glycemic control. And once we start the insulin, he says, "Oh, I started the insulin. Look, now I'm having the complications. My foot was amputated, my kidney is off, or I had a heart attack." Actually, it's the delay in initiating the insulin. So number one, number two, yes, it's an injectable therapy, insulin. It's going to be little bit painful to the patient, and now we are expecting probably in the second quarter of this year that we can have inhaled insulin available.
That's a great news, doctor. So that it will give some relief to people who are on
Of
insulin.
course, of course.
And how expensive is it? And how can a common man manage diabetes?
Diabetes, if treated early on with good glycemic control, is not expensive. The expenses on the healthcare, it increases when there are complications associated with the diabetes. So, as per se, talking about diabetes treatment, it's not that expensive, but with complications, the cost goes up all the time.
You got it. So, Doctor, you have a global exposure. I mean, you have traveled the world, you have treated many patients, you treat international patients as well.
Yeah.
How can our viewers or listeners benefit?
So I can tell that I've seen people, diabetic people from different continents and from various places. Uh, but if we talk about our own, Indian diabetic patient, uh, our average HbA1c is around 8.5 to 9. So we have got a very poor glycemic load, already in our society. And as I said earlier, that our treatment is, especially the insulin initiation, is delayed for many years. Uh, so we are at higher risk of developing diabetes, being Asian, what's called the Asian phenotype, and at a higher risk of developing the diabetes related complications. So we need to be one step ahead, as compared to let's say the Caucasian or the white population, in terms of diabetes control and management.
Right. And since people would want to meet you, consult you, will you be available in Gwalior city since you have started coming?
Yes, I would extend the good news to the people of Gwalior that I will be available second and fourth Sunday, every second and fourth Sunday of the month at the ITM Hospital. So we are running a special endocrine and diabetes OPD there. I would request the people to come and avail this opportunity, and benefit from the from the services the ITM hospital is providing to the society.
Great, sir. Thank you so much for giving us time.
Thank you, thank you.